Hello, Methodist Hospital.
My name is Summer.
My name is Me.
My name is Akeno.
My name is Andrew.
My name is Alex.
And welcome to our ER.
As you can see, this is our main waiting area. When patients first arrive, they'll check in here at the front desk. The front desk and the break room, which we will go on to later, is where medical staff can pick up their pagers for direct communication, allowing for faster notifications in emergency situations. On the front desk, we have a map of the ER where patients and guests can view. Our friendly staff will take care of all of the necessary information and record it on the computer to ensure smooth and efficient care. Once patients are checked in, they will receive a patient buzzer which will notify them when a physician is ready to meet with them so that the patient has more freedom and promotes less anxiety when they will be called upon. They'll be taken by one of our nurses to this area. We will perform routine checks like taking vital signs before moving them further down the hall. The reason why we take vitals early is to ensure correct triage and if the vital signs show symptoms of immediate care. These are our waiting seats where patients and guests will patiently wait for care. For pediatric patients who become uneasy and upset because of the long wait times, we've designed a rec room just to this door. Inside, patients and families can relax, watch TV, browse through books, or sit back in our cozy seating area while they wait to be seen and treated. This helps get the patient feel a little bit more relieved, especially pediatric patients. This door leads to the staff room, and as you can see here, the room has a red line which indicates it's a staff-only room. Many rooms in the ER will have this line, and it's called the red zone, which is only allowed for staff and patients who are directed by a staff member. It's a private space for hardworking medical staff to rest, take their breaks, or store personal materials. The room has a TV, some tables, a little kitchen sink, and a kitchen. It's just one of the ways we ensure our team can stay focused and energized throughout the hours and provide the best possible care. We also have bathrooms available right here for patients to use during their wait, ensuring comfort throughout their visit. One bathroom is for patients and guests only, and the other bathroom is for staff only. There are two doors which lead to different areas of the emergency room. This door leads to the emergent side of the ER, and the door on the other side, located here, is the non-emergent side. When walking toward the non-emergency side, we have a conference room for family consultations which are used to meet privately with family members, providing a space where medical staff can explain treatment options, deliver updates, or discuss sensitive medical decisions. Notice here this is a red zone which only staff and guests or patients who are directed by a staff member are allowed to go. The conference rooms can also be used for doctors, nurses, and other healthcare staff to meet and discuss patient cases in private and to maintain HIPAA restrictions.
Welcome to the non-emergent side of Methodist ER, where we care for patients who are a little less severely ill but still need medical attention. This is the pediatric area of the emergency room. This area specializes in care for children who have different needs compared to adults because of their different developmental stages. By having pediatric specialists who work in this area of the ER ensures that the children receive the highest standard of care tailored to their needs. For anyone with contagious illnesses, we have designed quarantine rooms. These rooms are isolated to ensure the safety of everyone in the ER. We prioritize health by maintaining a strict red nose zone, which is restricted to medical staff only, and to make sure that only staff enter this area. Medical staffs have their ID scanners, which opens the doors, and as you can see, this little black patch on the wall is the scanner. There are also 2 bathrooms in this section, which is available for both the patients and the guests, providing convenience and comfort for those who need to wait with their loved ones. Besides the bathrooms, we've placed comfortable seating areas next to the rooms for guests who are visiting their families or friends so they can stay nearby while their patients are getting the rest they need. Here we have the blood work lab where we take samples from patients to run important tests. Blood work helps us diagnose illnesses, monitor treatment effectiveness, and gather critical information to provide the best care possible for our patients.
Now we're at the nurse's station. This is where medical staff will closely monitor patients' vitals and make important decisions. If a patient has fully recovered, we will discharge them, freeing up space for others who have been waiting. If their condition continues to worsen and requires more intensive care, we will arrange a transfer with another hospital. Here, we decided to use only one desk as we are expecting less traffic, as this is the non-emergent side of the ER, where overall there will be less traffic and less movement of staff and patients. For patients, families, and staff who feel stressed or overwhelmed, we've provided a meditation room designed to help anyone decompress or find a little peace during their stay, with provided yoga mats and calming decoration and music. Next to the meditation room, we have a storage room for things like IV fluids, machinery, anesthesia, and over-the-counter medicine. Over here is the ambulance bay, where patients arriving by ambulance are brought into the ER under a protective hangover to protect them from outside elements during the transfer from the ambulance into the ER. This area is key for quick and efficient transfers into the ER, as paramedics and arriving patients are immediately greeted at the nurse stations to exchange information. Additionally, arriving from either end of the hospital, patients can easily access imaging or operating rooms if needed. Here we have 2 fully equipped operating rooms, which will be used to perform necessary surgery for emergent patients only. In both of our OR rooms, we have 2 entrances, one for staff, which they can come in and prepare necessary measures before surgery, and another for patients, which they will be prepped and brought in by nurses. Throughout the entire ER, hallways are very wide with the intent to avoid congested hallways and allow patients and staff to flow effectively and efficiently throughout the space into various areas of the ER. Additionally, we prevented congested hallways by splitting the entire ER into 2, between emergent and non-emergent patients, so that patients with higher priority can receive care quicker.
Next, we have the changing rooms, where patients change their clothes before entering the X-ray and MRIs. We have specific female and male changing rooms, and patients should leave all metal materials in this room and wear the appropriate clothing that is provided to them by the doctors. Right next to the changing room is where the X-ray and MRI rooms are located. This is where we perform scans to get a clear look at what's happening inside of a patient's body, whether it's to check for broken bones or to identify any other internal issues that will help with diagnosis and treatment. Next is our privacy rooms. These are the privacy rooms. These are specially designed for patients who have experienced traumatic or emotional events and need a quiet, safe space to recover. After a patient requests a privacy room from a doctor, they are placed in their own specific waiting room. After being called in, you walk through these doors where patients get to talk to specialized counselors and therapists available to provide support. These counselors and therapists aid in helping patients process their experiences and help them begin the healing process. Right next to our privacy rooms is the toxicology room. This is where we run tests to detect harmful substances in a patient's body, such as poisons or drugs. It's crucial for identifying potential toxins that might be causing symptoms. When a possible overdose patient arrives, doctors draw blood from that patient, and in this lab is where the substances inside the individual are located and identified. Next, we have the storage room. This is where we place basic necessary items such as gloves, blankets, machinery, tools, and much more. In this room, doctors are allowed to quickly locate what they need due to a specific sorting process.
Now, moving on to the nurse and physician desks. These desks are located close together so nurses and doctors can communicate quickly and effectively. The nurse desk is used to monitor patients' vitals and keep track of those in the emergent side, while the physician desk is where decisions are made regarding treatment. Both areas are equipped with computers to store patient data and monitor their conditions, ensuring we know when someone might need to be transferred to a hospital if their condition worsens. With these specialized rooms and workstations, our staff is fully prepared to provide comprehensive care to every patient who comes through our doors. Now, we're entering the emergent side of the ER. This is where patients with severe medical conditions are treated and require intensive care. Nurses and physicians frequently check in on these patients to monitor their status and provide urgent treatments. Each room is equipped with a bed for the patient and sockets to plug in any medical machinery they might need for their care. Due to the critical condition of patients in this area, guests typically aren't allowed to visit, ensuring the patient can focus on their recovery. Next, we have the security room. This is where we monitor the ER with cameras that run 24/7, keeping an eye out for any suspicious activity. It is a vital part of maintaining the safety of our patients, staff, and any guests. Finally, we have the janitor closet. Cleanliness is crucial in any medical facility, and this space holds all the supplies we need to maintain hygiene throughout the ER, ensuring a safe and sanitary environment.